There is one uncertainty that is universal for all humanity. Our death rate, all of us here, is 100%. Death is the most inevitable part of life. I'm Gina Hutchins. I'm a registered nurse, and I'm here to talk to you about 3 areas of hospice care. Hospice is a concept that dates back all the way to medieval times, symbolizing a place for caring, a place for the tired, a place for the sick. Hospice affirms life. There are 4,850 hospice organizations located across the United States, as Hospice of Southwest Georgia is one of those organizations. Criteria for hospice care is if a person's disease process takes its normal course, that person has 6 months or less to live. If that person's disease process takes an unexplained turn and that person lives longer than 6 months, they are still eligible for hospice care. One example of that is that back in 2008, I admitted a gentleman under hospice care. He was told by his physician, there's nothing else I can do, you just need to go home and talk to hospice. On November the 21st of this year, if everything stays the same, I will see that person celebrate 4 birthdays under hospice care. Hospice care affirms life. It is about living. It is not about death. There are a lot of misconceptions about hospice care, and one of those misconceptions is that hospice people, hospice patients need to have cancer diagnosis. This is not true. Only about 31% of hospice patients have cancer diagnosis. According to the National Hospice and Palliative Care Organization, 61% of hospice patients have non-cancer diagnosis. Another misconception about hospice care is that patients have to be a do not resuscitate, which means that they will not, do not, or cannot have any resuscitative measures should their heart stop beating or should they stop breathing. That is a personal choice. It's not a requirement of hospice care. Another misconception is that patients may not take their own medications or they may not visit their physicians. Patients may take their disease-related medications in conjunction with the comfort medications provided and managed by hospice. They may also visit their physician if they would like to. They're not required to, but they certainly may. Hospice care is an interdisciplinary team approach. Hospice care is not delegated just by nurses and doctors. Hospice care involves social services, chaplain services, bereavement services, and volunteer services. Volunteers are a non-paid part of the interdisciplinary team. Volunteers are very important to the family and to the patient. They offer a different aspect of hospice care. They deliver flowers, they provide pet therapy, and are able to help pull the whole interdisciplinary team approach together. Hospice care is about living, not dying. Hospice care is about comfort care, not curative care. Hospice care focuses on an interdisciplinary team approach, not an individualized approach. In conclusion, we cannot change the past. We cannot change the fact that people will act in a certain way. We cannot change the inevitable. We can choose how we approach death and deal with death. But we cannot change the most inevitable fact